مراكز علاج الطبية، رواد الصحة النوعية، أول شبكة طبية متخصصة تغطي خدماتها السعودية، الإمارات، مصر، قطر ولندن. علاج بلا حدود.
In elderly men, difficulty with passing the urine is usually due to disease of the prostate. In younger men, it's unusual to have problems from the prostate, and much the commonest cause, indeed in men of any age, is a urethral stricture. A urethral stricture is a narrowing of the pipe that passes urine from the bladder through the penis and outwards. A stricture is quite simply a scar, but when the scar goes all the way around the urethra, it can narrow down the urethra and cause obstruction. Usually this causes difficulty in starting to pass urine, a poor stream, a feeling that you haven't emptied properly, and a tendency to dribble urine afterwards. When this does occur, it can be just a minor irritation, but sometimes it can be very serious. Indeed, you can block off the urethral flow altogether, so that a state of retention develops when you can't pass urine at all. Most commonly, there is no apparent cause for a urethral stricture. More commonly, you might get as a result of an injury, damage to the urethra, or as a result of infection, scarring around the urethra. But apart from injury and infection, most patients have no apparent cause. The difficulty is usually best assessed in hospital by doing a check on the urinary flow rate. This simply means passing urine into a machine that produces electronic measurement of the flow rate. And if the flow rate is reduced, then the next step would be to get an X-ray of the urethra, of the water pipe, to see if there is indeed an obstruction as a result of a urethral stricture. Sometimes the next step will be to do a cystoscopy, to look up the urethra, up the water pipe with a telescope to see whether or not there is a visible narrowing. Indeed, some people have a cystoscopy for other reasons, and a stricture is picked up in this way. If a stricture is troublesome, when symptoms are a real bother, and when the urinary stream is very slow, there might be secondary problems such as blood in the urine or urinary tract infection. And when there is difficulty in any of these regards, with poor flow, bleeding, or urinary infection, then something needs to be done. In many instances, this can be treated very simply just by stretching up the narrow area or making a cut in the narrow area through a telescope, both of which, both stretching it up and cutting it through a telescope, are day case procedures. You come in, have it dealt with, and then you're out of hospital in the same day and the problem is dealt with. In about 50% of people with strictures, this approach is quite enough to deal with the problem. In the remainder, the stricture tends to keep coming back despite this sort of treatment, and something therefore needs to be done. This something is an operation called urethroplasty, and urethroplasty is designed to get rid of a stricture permanently so that no further stretching or cutting is necessary. Sometimes a stricture occurs as a result of previous surgery, particularly surgery on the penis in young children for a condition called hypospadias. In this sort of situation, or in other situations when there has been previous surgery, then stretching up usually doesn't work, and one has to go straight to an operation, straight to urethroplasty to fix it. Either way, whatever the cause, It's a simple matter to make a diagnosis of a urethral stricture. A few simple tests are all that are needed to prove the point, and treatment can almost always resolve the problem completely.